Please join me in congratulating Dr. Kate O'Brien.
Goodness, it's hard to walk up the stairs and not have an Oscar moment of falling down as some other actresses have, but I'm not an actress, so I managed to get up the 2 stairs on my own. Dear friends, my treasured family, wonderful colleagues, and brilliant awardees, Barney, Bruce, and the NFID board and staff, it's an incredibly humbling honor to receive this Jimmy and Rosalynn Carter Award. And it's incredibly exciting to be here with all of you in a room together, human to human, celebrating and appreciating the fact that we're in a room all together. And I couldn't be more honored to be part of this celebration. It's been too long, and it's been rather hard these past 3 years for probably everybody in this room. We've just passed the 1,000th, that's a hard thing to say, 1,000th day since WHO declared the COVID public health emergency of international concern. 1,000 days of this. We're all tired of it. We want it to be over. Before I say more, I want to first honor Paul Farmer, who's one of the winners of this award. He won it in 2006. And he's one of the people that we lost this year, and it was shocking to learn of his too soon passing. The world lost a true hero. And for those of you who knew Paul, I think you know exactly what I'm talking about. And it touched me a lot because my first job out of pediatric residency, which I did close by in Baltimore, and Matu Santosham, who's been my lifelong mentor, was one of my attendings as an intern. But my first job out of pediatric residency was in Haiti, as was mentioned in the video, in 1991, right around the time when Paul also started his work that was transformative work, globally transformative work in Haiti. And there's a saying in Haitian Creole that beyond mountains, there are more mountains. And this expression has many meanings. It can mean that there's just one problem after another, but I don't choose to see the expression that way. To me, it means there's always another mountain to climb, an ambition, a problem to solve, a contribution to make, a way that we can make a difference. And during those years in Haiti, I found what became my mountain, which has been the work on problems that I think the solutions make the biggest difference. And of course, that's the work on vaccines. And I think it's pretty hard to argue with that value proposition. And I've had this unbelievable, incredible good fortune to work with amazingly talented people. It's a little bit embarrassing, in fact, to get an award like this for the kind of work that I've done in my career, because it's always all about the people. It's about the teams that we have, teams that give off energy. There are many of you I've had the privilege to work with are here in the room, and mentors who have pushed me forward when I realize now I certainly had no business being in the lead or being in the forward position. And I've been especially lucky to have problems that were ripe for solving, though I think at the time we didn't always know it. The first part of my career was working with American Indians out on the Navajo and White Mountain Apache communities. Rich, proud, honorable people living incredibly authentic lives. And it was really the honor of my life to be able to learn from those communities what it really means to care for people and care about what they want. And I want to just focus on how much of a difference the kind of work that we've been able to do together over these past 25, almost 30 years. And that work has been in accelerating the use of vaccines and the availability of vaccines for those who most need them. That's what should come first, is those who are most in need should be the ones first in line. But it hasn't always been the case. And we're certainly not fully there yet, but we've come an incredibly long way since the days of hepatitis B vaccine and Hib meningitis vaccine, when it took 15 to 20 years before those vaccines were available to those who most needed them. In other words, people in low and middle income countries, compared with their availability to those of us who had the accident of birth to be living in high income countries. So I just want to contrast that 15 to 20 years from 25 years ago with what happened in 2020 and 2021. And it was 39 days, not 39 years, not 39 weeks, not 39 months, but it was 39 days between when the first dose of COVID vaccine was administered in a high-income country and when that first dose was administered in a low-middle-income country. 39 days. And of course, that story did not progress as we had hoped. There was deep vaccine nationalism. There was deep inequity. However, we've done better than we'd ever done before. Almost 13 billion doses of COVID vaccine, 13 billion doses have been administered worldwide, and billions of those doses have gone to those in need in low and middle income countries. You know, every life has a story, and every story has a lesson in it. And part of my story is learning that the opposite of poverty is not wealth, but is justice. And one of the greatest measures of a just world is an equitable one. And that's something that I think probably everybody in the room here shares. Bill Foege said that eradication of a disease is the ultimate in equity and social justice, and we continue to work to try to get to eradication of polio, and yet the world has put so many barriers and so many speed bumps in front of us. But I hope that in the near future, there will be an awardee who will be able to stand here who can claim that that ultimate equity has been achieved. So I just want to end with a couple other comments. First of all, I really want to appreciate Kathy Edwards and Kathy Newsel, who nominated me for this award and for your friendship, for your mentorship, for your partnership, for all of the ways in which we've been able to contribute together and think together. And I also want to say a few things to the women in this room. Certainly, these awards are about our careers, and Bruce's career, Barney's career. I'm so pleased to be here to honor you both, who are, in fact, miracle workers in so many ways. And the women in the room here have had lives that are complicated lives. I think it's fair to say that a woman's wisdom comes from the great juggle of her life. And I just want to express the appreciation I also have for the family that I come from, who have appreciated that as a full human, I had tasks and interests and contributions to make that were beyond my family, but they made a lot of sacrifices, sacrifices of time and of not having me present all the time when they needed me. So also for those in the room who may have felt that, I think it's okay, and I think there's a lesson to be learned in that our juggle somehow makes a contribution as well. So I just want to end with some words from President Carter that really touched me, and that is, President Carter said that to be true to ourselves, we have to be true to others. And I hope that in this world that we live in right now, that sentiment carries more weight than perhaps it is carrying in some of these fraught times that we have And I do have optimism that his sentiment and his wisdom will carry us forward into better days ahead. And I just want to thank all of you for being here and celebrating with me, and great appreciation to NFID. Thank you so much.